CareLogic IMPACT is a outcomes measurement and management solution that is integrated into CareLogic, our EHR system. It is a platform that is flexible enough to handle nearly every instrument, including the DLA-20. We are really excited to have this first partnership with National Council to integrate the DLA-20 into our EHR and CareLogic platform.
The DLA-20 is a functional assessment that satisfies part of the definition for medical necessity. They want us to measure symptoms and the impact of symptoms on functioning, and it stands for daily living activities. There are going to be 20 statistically significant measures that we need to track for our clients and help them improve.
The DLA-20 is really important to CareLogic and to our users because it is a really phenomenal functional assessment, and it's not just looking at symptoms, and it's not just about how well people are doing in terms of their symptomology, but it's really looking at the overall person. It's really looking at how they're functioning and can give our customers a clear idea of that overall person regardless of what services they're receiving. CareLogic IMPACT incorporates the DLA-20 in several ways to make it really easy for the clinician to complete. One is that we use what's called a clean form design so that there's not too much information on the page to clutter it up, but then we use hoverovers to provide additional context to the clinician when they're completing the instrument. And we also provide reference links and links to the anchors. Additionally, we provide automatic calculations of all the different scores that are really critical for the DLA-20 and for diagnosing. So as you get an MGAF score in the DLA-20, then we can link that into the diagnosis. In CareLogic IMPACT, with the ability to now collect the data as part of the clinical workflow and as part of an assessment, as part of the treatment plan, it's really reducing that resources for an organization that they previously had to have somebody who would go out and administer those paper and pencil surveys, who then would turn around and enter that data back into an Excel spreadsheet or SPSS, whatever they were using, and then run those reports. And CareLogic IMPACT now will be collected as part of the clinical workflow process and the documentation process, and then quite literally with a click of a couple buttons, they're going to have that report right there. They don't have to do anything to have the dashboards available. I think this is a great need in behavioral health care to really be able to understand how well certain populations are performing, and it's going to eventually lead to payments and incentives if they can really move the needle on some of these populations and start showing improvement.
We chose Qualifacts initially because they were so good with their relationship with us. We could feel like the DLA was going to be reliable. It was going to be helpful to providers. Plus, they had the clinical element, and that has been really important to me all along. It's not just an IT integration. So I knew that Qualifacts CareLogic would address the clinical concerns that I had, and that they would work with me over time to make sure that we made it as helpful to providers as possible. And they had a wonderful reputation. So many states, as I was traveling around the country, they said, "When are you going to contract with Qualifacts?"